live, and today I'm going to discuss something very, very important and essential for all our mothers out there. If you're a first-time mother, that's even more important, like how I am. I'm a first-time mother for Olive. So, yeah. So before starting this live, I would like to thank each one of you for making a miracle, and I especially thank God for giving me an overnight miracle by making one of our videos reach almost 300 million views, which I'm really, it's like what do you say, a dream come true. I've never expected to see an M next to my videos, but now I'm able to see that, and I'm so glad about it. Another thing I want to thank all of you is I would like to thank each one of you for your love and support. Today we have reached 10,000 subscribers just past this afternoon, and I'm so happy and glad. Thank you for being there for me and supporting this channel, showing your love and support to me and Olive, and sharing all your blessings. That's immense. That's immensely awesome. That's what I can say. So with that said and done, let's start today's live. Before just starting with all the information that I've gathered for all of you, I would like to say that this is one of the most important topics that I'm going to personally discuss, and I want you to stay until the end, because each and every section that I'm going to discuss in this live is very important, right? So if you are a mother and you have given Shizuka, thank you so much. Thank you. So if you are a mother and you have given birth recently, we will, have this kind of depression or feeling low or sad, having that frequent spell of cry, or, excessive sadness, or loss of appetite, or loss of intimacy with our, special one, our spouse or our family, that relationship is right, quite having a friction. So if you are also some of the person who is having difficulty in these things, so you may have postpartum depression that we are going to discuss today. So I'm just gonna have a brief blueprint of what I'm going to talk. I'm going to discuss what is actually postpartum depression, and the second one I'm going to discuss are the symptoms. How do you identify if you are having postpartum depression? And the third one is I'm going to discuss the possible causes of having postpartum depression. And the next point is I'm going to discuss how you can cope with this, depression if you have postpartum depression. And last but not the least, when to seek professional help, and will this postpartum depression go by itself? So these are some of the very crucial things that I'm going to discuss, and they are not of any thing that we have to take them light for. So please stay back. I'm not telling you to stay back for likes or subscribes or for my viewer attentionship. I genuinely care for you, I genuinely love you, and I genuinely want you to be happy and lead a happy motherhood. Because I'm a psychologist, I can understand how intense this can be. And just as a disclaimer, I am also one of the person who has suffered with depression in my early 20s, and I also had my postpartum depression just a few months before. So I personally wanted to share my experience, and I want you to come out of it and have lots of fun with your little ones. So without further ado, let's get straight into this discussion. And before that, I'll just quickly go through this chat box once. Sushma, hi, thank you for joining me. I'm good, Sushma, I'm good. How are you? How is your baby? Olive is doing good as well. Thank you so much, Shizuka, for your love since the beginning. Thank you so much, Buba, for your support. Yes, 10,000 subscribers and 3 million views, yeah. Thank you everyone for your support. Yes, so if you haven't watched those videos, please go and watch those videos right after this video. So let's get started with today's topic about postpartum depression. And excuse me, I'm sweating so badly because I literally have to turn off every fan that is present in this room, because you shouldn't have a resound of the sound. So I'm really sweating very bad. So please forgive me for that. Jashu, hi. Thank you for joining. Who else is here? Love you, love you. Thank you so much. So, what is postpartum depression? So, basically, it's one of the form of depression that's usually being affected by mothers. But let me just give you a disclaimer that this is not especially for mothers. Fathers also have some sort of depression after giving birth to a baby or during your pregnancy. You can see that, you know, while we are pregnant, our spouses, our partners are quite upset and stressed about, and you know, they're like mood off all the time. So that is one of the major reasons for them to be, you know, quite upset, because depression hits male and female. Depression doesn't have any gender, you know, psychological problems doesn't have any gender. It's just same for everybody. But especially this is more in mothers because of the hormonal changes that we go through, right? So during our pregnancy, our estrogen and progesterone and thyroid levels, they're all working very hard to keep up with the process of you know, pregnancy, and you know, making us and the baby healthy, and having maintaining all that metabolisms and all. They're doing their work to the fullest. So if your levels of progesterone and estrogen are at the basic level, when you're pregnant and you're giving birth and each month is passing by, your progesterone and estrogen levels are getting higher and higher. They almost get higher, 10 times higher than what they are supposed to be. So once you give birth, immediately those levels drop just in 3 days. So this level of all your hormones and all your things drastically change to a lower level. A sharp down is there. So that's the reason majority of women face this problem of postpartum depression. That's mostly, you know, chemical imbalances and all related, but it is also because of the major life changing things that we go through. We have a lot of physical, emotional, social, financial, and different kinds of changes, and our life changes completely. You know, earlier when we want to go shopping or when we want to go eat something, we just simply, you know, get dressed and get ready, take our purse and just go. But now you have to think, you cannot live like that. You just have to, you know, take care of the baby. You have to think who is going to take care of your baby in your absence, and you have to think about so many things. So your life will completely change, and that can be sometimes very overwhelming, and sometimes, you know, very quite frustrating, as you feel that you have lost your independence, you lost your identity, or you lost your physique, or you know, you lost your career, you lost your finances and financial independence in your career had a break, your education had a break, so many things. So we are not quite happy with everything. And let me tell you very clearly that you are not alone, and this is not your fault. We all go through the same thing. It's just that it's very overwhelming when we think about it, right? I can tell you one of my personal experience that I've felt in the very beginning, soon after Olive's discharge, when we came home. The doctor told us especially to keep Olive in a separate room and stay there, and I have to stay with her along in that room, and I shouldn't leave that room. And as you all know that I really have this kind of sweating problem when there's no fan or AC, so that room has to be very, very warm. So I started feeling very depressed, and I don't like compressed areas. I'm kind of claustrophobic. I like big spaces, and I need space in front of my eyes. So when I was sitting in that small room with no AC, very little fan, I was feeling suffocated, and that's when depression hit me hard. And at that point of time, my husband was at separate place, I was at separate place, and I was overwhelmed with the very small baby that we have to take care. And I was kind of thinking, like, am I giving, am I a burden to my family, am I giving trouble to them, what is all this, am I troubling my baby? So in various things I was feeling very, very lonely, extremely sad, depressed, and I was feeling helpless. I stopped working, so I had a break from my career, because that was at the peak of the time, and it was COVID time, especially pandemic. So all these things were quite overwhelming for me, and depression hit me very hard in the very, very initial days of my delivery stages. And another thing that I want to tell is, depression can hit you early as 6 weeks or 4 weeks, or it can also hit you anytime up till 1 year or even 1 year. Recently I had even identity crisis problem, that which I want to discuss in another video. Identity crisis and career crisis after giving birth. So let me just make it clear that depression is not only for women, it is also for men. So 1 in every 10 women and 1 in every 10 men go through severe form of depression. So here I want to make something clear is, baby blues and postpartum depression are both different. Baby blues usually go away within 3 or 4 days, but postpartum depression stays longer and it needs special attention. So if you have any of the symptoms that I'm going to discuss now, you need some special attention. Don't worry, your family is with you, your friends are with you, healthcare professionals are with you to support you and get you out of this condition. So you're not alone. Just have that hope, and we also have to make an effort from our side to get out of this situation as well, right? I just believe, if I'm just covering all the points. I've written quite a lot of notes for all of you. There is another form of postpartum depression, which is postpartum psychosis. This is an extremely high level of depression where the mother has the thoughts of hurting herself or hurting the baby. That is postpartum psychosis. That is very, very rare. And if you are one among the person who wants to hurt yourself, or you have the thoughts to hurt your baby, it's high time that you consult a professional psychologist or professional psychiatrist, a counselor who will help you with counseling sessions and also give you some medicines. If you're not having such extreme psychosis, you're just having some depression, we will take you through how to get out of it, right? So now let's move on to the signs and symptoms to know if you have postpartum depression. The first one is trouble sleeping. Of course, as new mothers, babies will wake up all the time and we have to feed, especially as mothers of preterm babies, we have to feed every 2 hours. I'm not talking about that. I'm talking when you have time to sleep, but still you can't sleep. I'm talking about that. Insomnia or, sleeplessness, that is one of the major symptoms. Frequent crying spells. We just cry out of nowhere. We feel like crying. I cried many times. There's no reason. We even feel hurt for very, very tiny thing. And we start crying frequently. That frequent crying spells is one of the symptoms. Severe fatigue, mood swings, loss of appetite, loss of interest in intimacy with your special one, with your spouse or partner, and you also feel extremely overwhelmed. I mean, like, we feel, what is all this? Especially this is hard for premature mothers because we are very, very stressed with such a small, tiny baby because we don't know how to take care of the baby, right? And another thing is no bonding with the baby. We feel that we are not bonding enough with the baby, or we don't have that relationship with the baby. I still evidently remember this. I was speaking to one of my very close friends, Pooja. She lives in Canada, so she called me like in the middle of the night. I was still awake and she was just asking me like, how is your baby, are you enjoying motherhood and all. She was asking me. I was like, I had no clue. I said literally to her, I said, I didn't bond with my baby. I don't have any relationship with my baby and I'm feeling overwhelmed. And she was quite surprised to know that from me because, I'm putting myself very vulnerable in front of all of you because I want you to understand that these kinds of feelings are not not something to be ashamed of, or not something to hide, or not something to feel low about yourself. This happens, this is the truth, and we have to face it, and we have to know how to come out of it, right? So even I went through the process where I didn't bond quite well with my baby. So no motivation, you don't have any concentration, you're always sad, extremely sad, and you feel worthless, you have feelings of guilt, and you also have the feeling of having, being a bad mother, which I personally suffered from too. So when I gave birth to my premature baby, what I usually felt in my heart is like, I was the person who was at fault. It is my mistake. I kept my baby in trouble. I'm the one who is giving trouble to my baby. I made my baby have all the procedures and injections. She has to be with me, but I made my baby stay in an ICU. I was mistake, it was my mistake. I was going through all these things and so many things in my head. So, certain things and thoughts in our depression are also extremely overwhelming, where sometimes they can be irrational, but still we feel them. And let me just tell you, sweethearts, that it's not our fault that we gave birth early. In fact, it is good that we gave birth early and we are taking care of our babies rather than losing the baby completely, being stubborn, right? I'm so sorry for the mothers who have lost their babies some or the other way through complications, but I thank God for saving Olive at the right time, because we were literally minutes and seconds away, because she had cord around the neck and she lost connection with me. There was no supply of blood and oxygen from me to Olive. She's just a miracle baby. I don't know how she survived. So I want to really thank God for that. It's not our fault. Just understand that. It just happens, and we have to be thankful that our baby is alive. Some or the other day they'll be fine, right? And not very long, very soon. So these are some of the causes, symptoms and signs that we have when we are having postpartum depression. So now I want you to comment, if you don't mind. If you have any of these symptoms, please comment yes in the chat box. Let's see how many of your mothers are having few of the symptoms. If you're having trouble sleeping, you're frequently crying, you don't have to mention what you're doing. If you're just having any symptom, just type yes in the comment section. Dr. Gill, hi. Sharma, your baby is so cute, thank you. Jashu, hi. Marina, hi. So all your mothers, if you're having any of the symptoms, please type yes in the comment section below. If you're having trouble sleeping, frequently crying, loss of motivation, no concentration, you don't have connection with your baby, or you have thoughts of hurting yourself, or you have thoughts of hurting your baby, or you have anxiety, extreme sadness, or you lost interest in things, you lost interest in intimacy with your partner, spouse, and you have worthlessness or feelings of guilt. If you have any of these things, please type yes in the comments box below. So now, as we have discussed about the signs and symptoms, let's move on to discuss the causes, right? So the causes can be, if you already had depression before your pregnancy. Like few of us have depression due to various causes, maybe due to our education, our anything, any reason. Depression doesn't have any particular thing. There may be many various personal reasons that lead you to depression, and if you had depression earlier your pregnancy, then you're more prone to have postpartum depression after your delivery. The second one is limited social support. If you're all by yourself, if you're a single mother, or you're living very far from your family, or your husband is very busy, nobody is there to take care of you and your baby, so that could lead to a lot of overwhelming feeling, and it can lead you to depression. The next one is pregnancy complications. Yes, if you have complications during your pregnancy, or you gave birth prematurely, this is one of the reasons for getting postpartum depression. You may not have all the causes and all the symptoms. You may have few causes and few symptoms. And if you have even few or even one, then it's time to take care of yourself. The next cause is you're younger than 20 years old and you gave birth to a baby, or you are older than 40, and if you are a single parent, or if you gave birth to a baby who is having disability, even that can be very overwhelming. We have few mothers who are wonderful and who are amazing in taking care of their babies, who are, born with a little bit of problems in their health. That can be very overwhelming. That can be one of the reasons for your postpartum depression as well. Another reason is it can be, you feel very less attractive because of all the weight that you have gained, because of overweight, or you lost your shape, and one of the reasons can be a break in your education or a break in your career, and your lack of social life, your commitment to being at home and taking care of the baby 24/7 can be very overwhelming, and this can be one of the cause to people who are usually very spoken, outgoing. They like to go out and party and socialize. It can be very, very depressing sometimes. Then change routines. Yes, we are used to work in the day and sleep in the night, but everything changes right after the baby, especially after preterm baby. So your routine changes. You have to be up. Your job is as a mother is 24/7. You have to work as a mother, and that can be very, very overwhelming, and it can stress you, and it can eventually lead you to depression. The last thing is, sleeplessness and lack of independence. As I discussed before, that may be either physical, social, financial, or anything else. So these are some of the causes. If you have any of the cause that I've discussed, then you can check with your symptoms if you have any of those. Right? Now, let's come to the most important point: how to cope with depression. What can you do if you have any signs and symptoms of postpartum depression? The first thing you can do is accept that parenting is overwhelming. Accept that your life will change. It is life changing, and it has commitment issues, right? You have to be committed to be a mother and a parent 24/7, and you have to accept the fact the sooner you accept, the better it will be. And the second point is, don't try to be perfect. Nobody is perfect. No parent is perfect. No mother is perfect. You cannot be perfect. Your child can't be perfect. So don't stress yourself and don't stress your child to be perfect, and you don't stress yourself to have everything so perfectly going on. It doesn't happen like that. Parenting is crazy, it's fun, it's messy, so we have to understand that, and don't feel obsessed with being that perfect parent and perfect child. And then you have to understand that you're not alone. You can talk to your friends, talk to your family, or talk to some healthcare professional whom you trust. Okay, it's not like you're randomly speaking to random people. You really choose the person who is willing to listen to you and who's not judging you. When you vent out the feelings, when you speak to somebody who is there for you and who's listening to you and understand what you're going through, that may be even your husband, mother, father, sister, brother, your friend, your any family member, or if you don't have anybody, you can just contact any health professional. They are willing to listen to you. So don't feel alone at all. The next one is, you can talk to healthcare professional, someone who is very good at their job in counseling you, helping you get through all these things in a systematic manner, not to overwhelm the situations. The next thing is, you can exercise. Exercise also helps a lot of good hormones and decrease the stress levels and depression. So go out, if you have time, ask help from your husband or your family, or you can hire a babysitter for some time. You go out, just walk and have something green around you. Take time for yourself and do something that you like, at least for 5 or 10 minutes. Even that will do great for you. Or when your baby is sleeping, just draw something or listen to a music, or read a good book, or if you like painting, do that. If you like to go on a walk, you can go that. You don't feel that you are the only person who have to take care of your baby. It's not like that all the time. There are so many people. It takes a village to raise a baby. So now we don't have villages to raise our baby, but we have our family and friends. We have our supporting husbands. We have our supporting friends whom you can, rely on at least for a few minutes to take a break from your baby, right? And then try to eat healthy and rest. I understand that when you're in depression, we feel sleepless, we feel very tired, and insomnia hits us very hard. But try to rest. Take a warm bath, drink some warm milk, listen to some meditation music or some relaxing music or the music that you like, and you try to fall asleep. Consciously try to fall asleep. I remember one of our professors, when I was studying psychology in the university, one of our professors gave a wonderful tip to actually sleep. We had a 1 week session on sleeping therapy. So we had guest lectures coming over, and one of the ma'am told, when you lie flat on the bed, close your eyes and imagine that you're floating on the water. So while you're imagining that, you slowly now imagine that you're drowning flat in the water. So if you do that, you will slowly fall asleep. That is a technique she literally made us do in the class, and trust me, it works all the time. So lay down flat on the bed and close your eyes. Imagine you're floating on the water, and now imagine that you're drowning. And don't be scared. It relaxes your body, and you will eventually fall asleep. If you're having very trouble falling asleep, there are sleep therapists whom you can take help from. Then you can go out, socialize. If you are a social person, a party person, take time off, go out, meet your friends, go to that ice cream parlor or go to a salon, you groom yourself and just come back all refreshed. That 10 minutes, that half an hour will really energize you for the entire week. Trust me on that. The next one is keep it realistic. Always don't try to make it perfect. As I said you before, always understand that motherhood has their both pros and cons. Sometimes we yell at our children, sometimes we will just get irritated and frustrated, and don't feel that is very abnormal. That there's nothing to feel abnormal about. It's all normal. We are humans, we have human emotions, and there's nothing wrong about it. So now I want to tell you few of the symptoms where you need immediate attention from a healthcare professional. If you are having thoughts to hurt yourself, or if you're having thoughts to hurt your baby, it's high time that you immediately consult a professional. I'm repeating myself, it's high time that you consult a professional, not talking to your friends or anything. You can talk, but that doesn't solve a problem there. Another symptom is you can't function normally. I mean, normal day-to-day things, like, getting up from bed, doing your things, taking a bath or eating or doing something, general household chore. If you're not able to do that, it's a high time that you are falling into severe depression and you need a professional healthcare support. The next one is you're extremely anxious about things. Being anxious as mothers, I understand that's normal, but extremely anxious, extremely sad is not normal. So you can take help. There's nothing wrong. It's not your fault to feel that way. Sometimes, our bodies and our hormones can also have a role in that. And there is a systematic procedure through counseling, or there are some medicines that you can take for very little time of your life. And trust me, those things will really help you a lot to get out of these things. And last but not the least, if you have suicidal thoughts, or if you have thoughts to end your life, or if you have thoughts of ending your baby's life, it's high time that you immediately seek professional help. So that's said and done. I hope all your mothers will be careful about it. Don't take it light. Baby blues usually go away in 3-4 days, but it is more than 2 weeks, then you need some sort of help. So as I said, listen to music, go out, socialize, have a life for yourself, go to a salon, read a book, talk to your friend, watch a movie, or sleep well, eat well, do some exercise, go out. Those little things will really make a lot of difference in your life. So while I was actually reading about this postpartum depression, I came across wonderful points that I really want to share with you. So I'm going to make a series on postpartum depression because there are tons of other things that I have to discuss with you, and that's not possible all at once. So I'm going to do it in a series. So now we have finished our first half an hour briefing you about postpartum depression. Now it's time for you to ask me some questions if you have any questions about this topic or about any other thing, and I'm willing to answer your questions. So shoot your questions to me. Did you like today's session? Did you learn something? Was it helpful? You could tell me that as well. And I'm so glad. Thank you so much for joining me. Now you can ask questions because this is Q&A time, right? And if you don't have any question, you can either tell me, did this session help you, or did you have some valuable information in this session? I believe, you know, I did good job. Yeah, I found many points that were really new for me, and I had some self-realization points where, like, yeah, this might be the cause, or this might be the reason. Yeah, I used to behave like this. So yeah, while I was studying, I realized all these things. Yes, so I'm going to make a complete series on postpartum depression very soon. I have to first finish Dr. Lata's series, and then I'm going to start this. Yes, so yeah, mothers, please go ahead and shoot your questions. Hello, hi Supriya, hi Desi94, hi Sony Mandala, hi Sona. How to connect with baby? I'm going through very severe postpartum depression. Please help me. Yes, I understand you more than anybody, I believe, in this platform because I really struggled connecting with my baby, and that very thought of not getting connected to your baby drowns you more into depression. So what is it, Isona? You first remove the thought, put it aside, let it be a fact, accept the fact. Now let's move on to what we can do. Yeah, so the first thing that you can do is, when you need to acknowledge the fact that bonding doesn't happen like this. Imagine just like any other relationship. For example, you and your husband. Did you just bond like in a minute? I don't think so, right? It takes some time. So understand that bonding takes time. The more you care the baby, the more you take care of the baby, the more you spend time with your baby, laugh with the baby, look into the eyes of the baby, smile with the baby, tell baby some jokes, read some books to the baby, hug the baby, have that physical touch. Physical skin to skin touch also builds a lot of bond. Skin to skin and eye to eye contact also helps a lot in bonding with your baby. So don't think that the babies doesn't understand what you talk. They do understand, they try to understand, and then love it when their mother speaks to them. So try to speak to your baby, share stories, tell them how much you love you, kiss them, hug them, give them that skin to skin. Eventually, as you're growing and you're doing that every day, that will eventually have a strong bond. Don't forget skin to skin and eye to eye. Look into the eyes of your baby when you're talking and smile. Your baby will smile at you. That's how you're going to develop bonding with your baby. And I'm sure, Sona, you're going to do an amazing job very soon. They say 94. My daughter, after 14 days in NICU, now she's good. 1.9 kg respiratory distress. Oh, congratulations for your precious baby. I hope the baby is doing well now. Loads of love and blessings to your baby. You know Hindi? Yes, I know Hindi. Yes, a little bit. I'm not like perfect. It's my second language. Yes, I know. Thanks. No problem. I'm so glad all of you have joined today. Yeah, you can ask me any other question. You can tell me about today's session as well. If it was helpful, or you have any other doubts regarding postpartum depression, you can ask me that as well. I'm here to answer your questions. Sona, hello ma'am. There's another problem. My baby is preterm baby. I don't have enough breast milk. So he's fed by formula milk. I'm so worried. So now don't worry about it, because even I have a preterm baby and I didn't breastfeed the baby long. So it was only 1.5 months that I fed my breast milk, and then from that day onwards up till her first year, she was completely on formula feed, and there's nothing to worry about. Usually people worry about formula milk because they don't have antibodies in that. I accept it, it's true. But you can take care of the baby using high, hygiene. Put hygiene your topmost priority so that your baby doesn't fall sick. And then after 6 months, when your baby starts solid food, they will eventually develop that, immunity and antibodies, and eventually everything is going to be fine. So don't worry about feeding formula milk to your baby, and that's in case a very good thing, because it promotes weight gain faster, and it has so many nutrients in it that it makes your baby chubby and healthy and strong. So don't worry. uh, I think 25 ml every 2 hours. Yeah, you can. It depends, the feeding ml depends totally on the weight of your baby. So feeding exclusive formula milk is nothing to worry. Yeah, Sona, did I answer your question? Are you okay now? Which method is good for sterilization? Electric sterilization, or either one is good. Either one. I used to do both depending on my time. And electric, I went sterilizer. I made a video on that. It's very easy to use, and it's more comfortable than the water boiling and then the ordinary method that we use. That's totally fine. Either ways, you're just sterilizing. The purpose is fulfilled. So there's no problem in that. Yeah. Come on, people, please shoot your questions sooner so that I have quicker answers. I don't have to wait. Ma'am, where are you from? Love from Rajasthan. Thank you so much. I love to visit Rajasthan. I used to beg my husband to take me to Rajasthan because I love to have desert safari. And I love your dresses. Yeah, they're so good. I'm from Telangana. Have you ever been to Telangana? But now my husband is in Europe, and I don't know. I don't have any option to travel. I used to travel only with my husband, and nobody in my family loves to travel. So I don't know when will I come. Love from Kerala. Thank you. I've been to Kerala actually soon after our wedding. Me, my husband, my sister, and my brother-in-law. So four of us, we came to Kerala and we had loads of fun. It was amazing. It was lovely. Very nice. I have subscribers from various people. Now, when I come to your city, I think I can meet any of you. Yeah. Actually, Jaipur, Pink City. Wow, that's nice. Sony, actually, I got fever. How many times does formula milk give in a day? It is 3 times in the box. Can we get more? Formula milk, it has to be given every 2 hours in the first 3 months, and then it has to be given at least 8 to 9 times up till 6 months. It's not 3 months, sweetheart. I don't know. I've never seen that on the box. You have to use that within 3 days, I guess. It's like less than 1 week. 1 week is the maximum time that you have to use formula milk once you open the box. But the number of times you feed your baby, you have to feed every 2 hours. Please don't starve your baby like that. Sony, how old is your baby? I mean, like, how are you feeding only 3 days a day? I just can't understand. That's quite surprising. Yeah. 2 hourly feeding in the first 3 months. That's for sure. Yeah, please shoot your questions, moms. I'm waiting for your questions so that I can answer before I move on. I'm just having 15 more minutes. So yeah, please. I think we can give multivitamins and vitamin D3 in case of premature. But yeah, of course, the doctor will give you medicines for even term babies up till 1 year. Not all the doctors, but for premature babies, they will definitely give you medicines. I've made a separate video on the medications that I used for Olive. It was like iron, D3, multivitamin, and calcium. because their bones are very, very tender. I've made a separate video. I've given all the details on which time I give what and what is the dose and all. Yeah, you can see that video. It was a old video. Can you suggest some toys for 3 months old baby? Okay, I have a video where I've made play gym. It's called play gym, where your baby will be sleeping like this and a mat, and there will be a U shape on your baby, and some toys will be hanging around, and at the near the legs of your baby, the baby has some piano, so the baby can practice kicking and holding the toys. I've made a separate video on that. You can check out the price, where I have bought, and I've also given the clippings on how Olive was playing with that. Play gym is an excellent way to help your baby gain strength and stamina around 3 months of age. Olive loved that. You know, she literally, for example, it is like 10 rupees. She played it like a worth of 1,000 rupees, that much. Okay. Sony, me giving 2 hour feeding while we get fever to mother, what should we do? There's no problem. In fact, when you are sick, your blood and your breast milk has antibodies. So when you feed the milk to your baby, that antibodies will also pass to your baby, and that's very good. So there is a myth actually saying, in Indian tradition, they say, when the mother is sick, they usually don't feed, but that's not the case actually. Your body develops antibodies to fight the fever, so it's good to continue breastfeeding, no problem. Doctors suggest breastfeeding even if you get corona. So fever is nothing in front of that. Don't worry. Continue breastfeeding, don't stop. Don't stop breastfeeding. Continue. Jaya Mani, hi. Can you please tell me the 9th month preterm baby food chart? 9th month, usually you can go and start with rice. You can give egg. You can give some fruit. I've actually started pretty much everything by 8th month. But I've made a separate video on complementary food with Dr. Lata. For more details, you can watch that video. For now, I'm telling what I have given to Olive. I've given her rice. I've given her all types of fruit puree, and I've also started chicken as early as like 8th month, I believe. She like halim, you make it like a paste, and I gave a very tiny bit. Um, you can do that if your baby is accepting that. And I started egg yolk. I have given that, and some uh, steamed veggies you can give at the end of 9th month, not as early. Yeah, mostly they'll take rice cerelac and wheat cerelac and all these puree form of things. So you can try giving various things to your baby. By 8 months, technically I've introduced everything. But for details, you can see Dr. Lata's complimentary food in our channel. She has given complete details on which month, what to start. So you can watch that video. Yeah. Ma'am, doctor has a hard skin at head, backside due to oxygen mask clip. So tell about medicine. I'm so sorry, I cannot talk about medicine because first of all, I'm not a doctor, and your doctor has to suggest that. So you can discuss this with your doctor and seek the proper medications. And please don't ever ask anybody for oral medications or any type of treatments if the person is not a doctor. And that too, it has to be a pediatrician, not any random doctor. You can ask for general opinion to a random doctor, but if you're having really specific problem, it's highly recommended to ask the specific specialized doctor. In our case, it's pediatricians, right? Yeah. As Jaya, as Desi94 has suggested, you could go with khichdi and dalia. I've made some recipes in our channel as well, like khichdi and poha and all. You can use that. When to start solid food for preterm baby? I have made a video on that. Haven't you watched that, Sona? When to start, so with the same title, when to start for solid food for preterm babies. So basically, it's all up to your baby. Your baby's development matters a lot. So if your baby is ready, then the doctor will examine the baby and they'll tell you to start. It's usually after 6 months. But for few babies, they'll tell you to stop and wait because the baby still has to grow and develop. So don't take your own decisions while starting solid food. It's always best to go to the doctor in your usual vaccination schedule and ask them. They will tell you when to start evaluating the condition of your baby. So in our case, we started at the end of 6th month, almost in the 7th month, but only when doctor said. He himself said, even I didn't ask him. He himself told us, like, start solid food, and then we started. Thank you so much, Akka. This PPD is really a torture. Had to go psychiatrist recently, but I think I really took good care of my twin girls despite having it. So happy to see my preterm twin. Congratulations for your precious baby, Sweta. Usually, yes, we as mothers have that inbuilt ability to take care of our babies despite our own problems, and you have done a tremendously great job. I congratulate you for that. I hope you're doing well. Bhuvana, hi Bhuvana. Hi ma'am, I don't have breast milk. I'm completely giving formula milk to my baby. No problem. Even I did the same from 2nd month. Technically 1.5 months. I was completely on formula milk from 1.5 months. 1.5 month I've had exclusive breast milk, and then from 1.5 month until 1 year it was exclusive formula milk. There's nothing wrong. Just take care of sterilization and proper hygiene conditions because they don't have antibodies, as I said before. And you just have to take care of uh, sterilizing your bottle after every feed. Warm the water that you're using to mix the formula milk. Warm it and cool it. And take care of the environmental hygiene where you're putting your baby, and everything is going to be fine. There's nothing to feel sad or ashamed when you're feeding formula milk. I think that has to really break. Shweta, all thanks to your videos, I really became strong after seeing you taking your cute Olive. Thank you so much. It's all by your support and love from all of you. And I really thank each one of you for that. Any more questions? Because we are already discussed a lot. If you have any more questions, you can shoot it, or else we can call it a day. Right? Anybody, any more questions that you have that you want me to answer personally? It's regarding postpartum depression, or any other topic that you have. You can ask me the question. Okay, I'll wait for another minute and then we can call it a day. I hope you enjoyed today's session and you learned something out of it, and I hope I could help you a little tiny bit of what I can do. And in further, I will make a series separately on postpartum depression because this is a vast topic. I realized that when I was researching about this topic, and I understand that there are many topics that we have to personally discuss because it is about our healthcare. I'm going to make a series of that very soon. Jaimani, thank you ma'am. I'm almost 27-week preemie. I have been watching your videos since I was in NICU. That's so sweet of Jaimani. Thank you so much. Can we start tummy time on 3 months? It depends on the weight of your baby. Sona, you can consult your doctor, because if the weight of your baby is good and if your baby is able to handle, then you can give tummy time. But I personally haven't given tummy time at 3 months. I think I've started tummy time at the end of 4th month because she was still very tiny. Yeah. So it depends on your baby. So you don't trouble the baby unnecessarily, because our babies, can be as little as 1 kg or 2 kgs. So it depends on the weight of your baby. Ma'am, you're so inspiring. Thank you so much. Thank you. I just humble myself on that. And Jaya, I'm so glad that you found the videos right when your baby is in ICU, because when Olive was in an ICU and I was trying to find videos, trust me, I didn't find any helpful video, and that was really depressing, adding to my terror of taking care of a preterm baby. But by the grace of God, I had a lovely doctor Olive's doctor was very, very specific in explaining me everything, right from, feeding, sleeping, sleeping positions and burping and how signs of emergency. He just taught us everything, feeding, tracking, using coconut oil, everything. I'm so glad somebody found this videos helpful when the baby is in ICU. Please make a video on white discharge and how to balance pH and vaginal infection. Okay, so Shweta, actually my sister is a gynecologist. She's Dr. Preethi Dayal. She has a separate YouTube channel where she is making videos on these topics. I think she has covered about vaginal discharge very clearly. She has explained it excellently. You can go and check out that video. I will leave the link to my sister's channel uh, below in the description box right after this live, because now I can't add it. I have to add it once I close this. Dr. Preethi Dayal, gynecologist, is the name of the channel. She is a gynecologist and she has been practicing since almost 5 to 6 years. You can go and check out her channel for your problems related to, your self, um, menstrual problems or productive problems or anything. Cool, thank you, Akka. And the best part is she does that in Telugu, so you can understand it more better. Both Hindi, like English and Telugu. Yeah. Smart Telugu homemaker. Hi, hi. I like your title, Smart Telugu homemaker. You're very smart in your title as well. Yes. Thank you for joining. Can you all hear the sound? Olive woke up and she is with my mom. And these days, I realize that when our babies are small, our problems were small. When our babies are growing, our problems are growing. Now, Olive is a toddler. It's so difficult to handle a toddler. I was so happy dealing with a preterm baby. I had no issues. It was only feeding, burping, sleeping, nicely enjoying with the baby, telling stories and singing songs. Mostly I used to tell stories and sing songs for Olive. I enjoyed that time. But now she's like a little monster, little dinosaur. She's like all over the place and she's just has her own personality. She has her own this thing and like her own taste and everything, and she just doesn't listen to anybody. And you can see her going, you know, she's very, very, very individual, has a strong personality. We are so inspiration. Most of the mothers recently, I got your channel, really inspiration. Thank you so much. That's so sweet of you. I'm so glad that the videos are helpful for you in some or the other way to handle your motherhood. And I'm so glad. So now that the little monster is awake, I have to go and attend to her, or else she will just not leave me like that. Olive, you want to say bye to them? Please don't mind. I didn't dress her up. She just woke from her sleep. So accept her as she is. Because kids are kids. Anyhow, they are cute. Yeah, aren't they? Chunu. I call her Chunu. I call her Chunu. My husband calls her Chakku. And my sisters, they call her Chakkani. And my brother-in-law, they all have their own different nicknames to call Olive. I believe your babies also have the same thing. Aren't they very cute when they are being called with different names all throughout? Her name is Olive, but nobody calls her Olive except few people. And one of my sister calls her Oliva. Oliva is like in Telugu. Olive in Telugu is Oliva. Yeah. It's there, and she's not coming. You see, if she wants to come, she will come. If she doesn't want to come, she doesn't come. She has strong personality. My child, trust me, being a mother of a preterm baby is very, very good. Just when your baby is toddler, you will understand the meaning of the things that I'm telling right now. They just go everywhere. Whatever we feed, they say no, I don't want to eat. You cook 100 different things, they'll say no, they don't want, and they want to go here, they want to go, they always want to go out, and they don't play with toys. They want our phone, they want remotes, they want AC remotes and TV remotes. They want to break everything, they want to run away here and there. They are little monsters. Trust me, preterm babies are so cute and adorable, because when we just feed them, they will nicely drink and nicely go to sleep. Most of the time they'll be sleeping. Happily you can do your work. So yeah, so that's the thing, and she's not coming despite calling many times. So I think she will not come. She's busy playing with her grandma. So now I'm going to end this live session. Thank you so much everybody for joining this live session. I hope you learned something today. I hope it was even a tiny bit of help to you today. So I'll see you all in the next video. Until then, take care of yourself and take care of your little ones. If you haven't subscribed to our channel yet, please go ahead and join our mom, dad, olive family by hitting the subscribe button and the bell icon next to it. Bye bye.